Suffering with dry eye syndrome can be really frustrating. Maybe you yourself feel like you've tried every eye drop at the store and doing warm compresses and even some medications that you've maybe tried with your eye doctor, just nothing seems to help. So in this video, we're going to break down some of the most modern and advanced dry eye treatments, which include medications that your eye doctor can prescribe, as well as in-office treatments that are available for dry eye disease. Dry eye can be super complicated, but there is hope out there. There are many treatments available, and so I want to break this down so you know what options may work for you. So go ahead, blink your eyes a few times, and let's take a look. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, and on this channel we've talked a lot about dry eye in the past and various treatments that are out there, but medicine is always changing and new medications and treatments for dry eye are becoming available. So I figured we'll break down some of the newer treatments that are out there and different things that may be offered to you through a visit with a dry eye specialist. First of all, I do want to say that dry eye is a very complex disease with many confounding conditions and causes. For example, exposure keratitis, where somebody's eyelids don't close all the way and their eyes are exposed to air constantly. Or maybe something like neurotrophic keratitis, where somebody's corneal nerves get damaged and then don't function properly and then the eye doesn't heal right. So these are all different examples of how dry eye can be associated with different conditions, and the treatments for those different specific conditions we're not going to be listing here because we just don't have the time. But I have either covered that in previous videos or I plan to cover in future videos. So if you haven't subscribed to the channel, I encourage you to do so and ring the bell so that you don't miss any of the future content that we'll be going over. And I don't mean to overwhelm people with how complex dry eye is, but I think it's important just to fundamentally understand that there's many different treatment options, and everybody that has dry eye may have a different kind of classification or many different things kind of going on all at once. And so there really isn't usually one treatment that works for everybody. It's usually kind of multiple treatments that are often applied all at the same time to get a desired result. So now with that out of the way, let's talk about some dry eye treatments. Now, in the medical world, we often do abbreviate dry eye as KS, or which stands for keratoconjunctivitis sicca, which is the medical term for dry eyes. But one of the most common and most historically used eye drop medications prescribed for dry eye is that of cyclosporin A, more famously known by its brand name called Restasis. Restasis is typically prescribed one drop in the morning and again one drop in the evening, and these eye drops are supposed to help reduce inflammation that's occurring within the lacrimal system where your tears are produced, for which the hope of using Restasis is that it will stop the inflammatory load from hitting the lacrimal system and then you can start producing your own tears again. The biggest downside of using Restasis is that it does often take 3 to 6 months to really start noticing a benefit. And that's because it, as an immunomodulator, it doesn't necessarily kick out the inflammatory proteins which are already attached to the lacrimal system. It just puts up a block there while the older inflammatory cells, which are already latched onto the lacrimal gland, need to wear off. And that's exactly why most eye doctors do prescribe medications like Restasis for at least 3 months at a time, because it's going to take at least that long to start even noticing even a little bit of a benefit. Now, recently, cyclosporin A has become generic, so generic forms of Restasis may be available through local pharmacies, but there are also some other competing brands making different formulations with the same active ingredient of cyclosporin A. One of those medications goes by the brand name of Cequa, while another one that I've prescribed for some of my patients, which is a compounded formulation that goes by the name of Klarity C. Both of these prescription medications, again, use cyclosporin A as the active ingredient, but they do offer them at a higher dosage, still prescribed twice a day, but a higher dosage of active ingredient. And then specifically Cequa, the company that makes that, has what they call a micellular technology, which is believed to be able to allow that medication to be more efficient. And so they do claim, at least in my experience in the clinic, that we see people having improved symptoms from their dry eye using medications at that higher dosage like that is somewhere closer to about maybe 4 to 6 weeks rather than waiting an entire 3 months. Financially, some of these medications do also have a downside, especially here in the United States. Some people do end up having to pay up to maybe $500 a month if they're not getting any sort of insurance coverage for these medications. Thankfully, many of my patients do get some level of coverage, but for those people who just can't, they just don't have any coverage with their insurance, then an option like Klarity C, which is compounded through a pharmacy, that's often available for a cash price of somewhere around $90. Depending, of course, if that's even available to you and where you're shopping around, those prices may vary. But historically, cyclosporin A or Restasis has been around for a long time and is probably one of the eye drops, prescription-wise, that most people will be familiar with. But just because of how long Restasis has been out, there's been a lot more research done with it, and so there are a lot of other research publications for its use outside of dry eye as well off-label. So I do find that a lot of eye care professionals, whether optometrists or ophthalmologists, do tend to gravitate and use that medication because it just has a lot more scientific support just because it's been out for so long. But I tend to notice a lot of eye doctors often do start off with a medication somewhere in the realm of using Restasis or cyclosporin A. Now, another prescription eye drop medication that's very similar in that it's dosed twice a day, once in the morning and once at night, is a medication called Xiidra, or lifitegrast is the active ingredient. Now, the exact mechanism of action for lifitegrast isn't fully known at this time, but it is believed to work in a similar way in that it reduces inflammation on the surface of the eye, which is a major issue when it comes to dry eye syndrome, because once your eye starts having inflammation, it's kind of like adding gasoline to a fire. It just makes things worse. And that's believed to be one of the reasons why no matter what people do to try and add tears and improve things on the surface of the eye, nothing seems to work because this inflammation is constantly running in the background. Now, Xiidra has shown in their studies to be able to improve both signs and symptoms of dry eye for their patients using the medication. The only real big kind of downsides I usually have to talk to my patients about are some of the subtle and rare side effects. Mainly that when you first put it in, some people notice their vision goes blurry for the first 30 minutes, some people notice redness and irritation, and then some people even kind of get a foul taste in the back of their throat. Honestly, not a huge big deal about the taste in the back of the throat, because if you brush your teeth around the same time, that kind of peppermint taste of whatever your toothpaste is kind of masks the nasty taste of the eye drop. Plus, if you do get that nasty taste in the back of your throat, guess what? That means your tear duct is not blocked and it's working. That's a good sign. Outside of this, Xiidra does tend to work a little bit faster than something like cyclosporin A, and I've seen patients report back even as soon as 4 to 6 weeks having improved symptoms. Other than these little side effects, the only other downside is maybe the price of Xiidra. If you do not have insurance coverage, like here in the United States, then the price of Xiidra can be upwards of somewhere around that $500 mark every month. But again, usually in my experience, a lot of patients do get good coverage. Now, dry eyes is often a chronic condition and is not really believed to be curable, however, something that's treated and managed. Kind of like arthritis. People will have flare-ups in their joints on occasion, and then they have to see a rheumatologist to get medication to get the flare-up under control. Now, dry eye, very similarly, some people are believed to have flare-ups where their symptoms get worse now and again. And for those reasons, a lot of eye doctors will prescribe topical steroids to get things under control. Steroids is a medication that eye doctors prescribe often after any sort of eye surgery because it helps control the inflammation that occurs during surgery, and then helps with pain, irritation, redness, and overall helps just decrease an inflamed, angry eye. So eye doctors do often prescribe steroids for those flare-ups of dry eye, but usually only for several weeks at a time. And the reason for this is because steroids do have a known side effect of potentially causing problems such as advanced cataracts inside the eye, as well as potentially increasing the eye pressure of the eye, leading to glaucoma. So the use of steroids is a common practice for dry eye treatment, but usually only for a few weeks, because again, long term, we want to watch out and don't cause any problems. And that's often why eye doctors end up reaching for something like a cyclosporin A or Xiidra as a long-term safer option. as far as a recent development, there is a new eye drop steroid medication that's approved by the US FDA called Eyesuvis that's used about 4 times a day for at least 2 weeks, but is specifically been approved for dry eye treatment. And just the formulation of Eyesuvis is at least a soft steroid and is a little bit safer and less likely to cause eye pressure issues than other more aggressive forms of steroids. Next up, since we're still talking about all the different eye drops that are available, I want to mention something called Autologous Serum. Now, if you've never heard of Autologous Serum, this is where your doctor will order a lab draw, and then they'll actually pull your blood from you and then centrifuge your blood to pull the blood cells out of it, and what's left is basically your serous fluid that has a lot of chemokines, cytokines, and anti-inflammatories and antibodies, which then can be used in the form of an eye drop to basically supplement your tears. This works as both an artificial tear to add lubrication to the eye, but also all of the extra proteins which can help with healing of the ocular surface. Now, this has been around for a long time. The biggest difficulty is that a lot of eye clinics don't have access to a laboratory to do a blood draw and actually create these. But thankfully, there is a new service called Vital Tears, and I'll put links to both this and all the information we're talking about in this video in the description below that like button if you want to learn more. But Vital Tears is a service that your doctor can work with where someone will basically come straight out to your home and they'll be able to do the blood draw right there, and then they'll centrifuge it back at their lab and mail it back out to you. And this is a service that many eye clinics will use, and in my experience is very successful. Most insurances do not cover autologous serum, but it is certainly an option, and I know some people have had just amazing success with it. But even though it's been around for a long time, it's definitely often considered one of the kind of end stage, last resort sort of treatments. Now, a couple of newer treatments for dry eye are centered around something called neurostimulation. Originally, there was a device called a TruTear, and this one actually was a little prong-like device that you would stick up your nose and press it, and it would give you like a small electric shock. And that would stimulate your 5th cranial nerve in your nose, which would then send a signal to the 7th cranial nerve, which communicates to your lacrimal gland, and you'd produce more tears. Now, since then, the TruTear has been discontinued, but there is now the iTear 100, which works kind of similar, except it just tickles the outside and vibrates against the outside of your nose. And then there's the new nasal spray that we've covered in a previous video called Tyrvaya. Now, the basic fundamentals of how all of these treatments work are all basically the same. Again, they stimulate the 5th cranial nerve to go to the 7th to make more tears. But at least in reports for Tryvaya, if you've seen my other video on that, they do show a pretty consistent increase of basal tear secretion. And personally, I think one of the best reasons that neurostimulation as a treatment is pretty exciting is that we're not having to add more eye drops to the surface of the eye, and usually that means less preservatives getting to the eye as well, so there's a cool benefit there. But at least in my own experience, the medication Tyrvaya is something that I have used and had good success with. It even kind of wakes me up in the morning. But again, like many other new medications, Tyrvaya is something that usually does cost somewhere in that $400 to $500 range unless you have coverage with your insurance. But at least in our clinic, we usually do have samples a lot of these medications. And so for our patients, we often get a sample to them and they're able to try it out for a little bit just to see if it's something that they have a reaction to, or at least see even if they have any sort of improvement while using it before they go ahead and invest in a bunch of different medications. So just as a side note, if any of these things that we're talking about here, make sure to talk to your doctor and ask about them, maybe write it on a list and bring it in, just in case they happen to have any samples or something that they may be able to provide for you. Now, another classical dry eye treatment that's been around for a long time is that of using punctal plugs. Your eyes have a little drainage tube on both the bottom and top portion of your nasal part of your eyelids, and this functions to drain tears and any of the debris that are in your tears out of your eye and through your nose. That's why if you've ever remember crying when you were a young kid, your nose often starts to run. And that's because your tears are draining through that canal. So the whole idea of using a plug is that you're plugging up that drain and increasing the amount of available tears that are resting on the eye. Punctal plugs are available for a short-term, several days to week use in the form of collagen plugs that eventually dissolve, but there are also more permanent plugs which can last for 6 months and beyond. Now, I personally found that punctal plugs are a great option for some people, especially for people who are intolerant of things like contact lenses. But there is a concern about patients who have a lot of inflammation on the surface of the eye, especially concerning their oil glands of their eyelids. Because the idea is that if you plug up that drain and there's a lot of inflammation and other garbage floating in the tear film, those toxins end up not being able to drain through the nose, and so they just get held there on the eye, and that perpetuates the inflammatory response. So if you happen to be somebody who has bad meibomian gland dysfunction or blepharitis, your doctor will likely recommend treating and getting control of that blepharitis, that inflammation, first before considering putting plugs in. But that's why another huge area of focus in the world of dry eye is management of the eyelids, and that's specifically of meibomian gland dysfunction, also known as MGD. And we've done a lot of other videos on this topic, largely because it's something that I personally suffer with myself from many years of contact lens wear and staring at a computer screen, either going through school or playing video games most of my life. So management of MGD is something I've done several videos on. If you haven't seen those, there's many treatments and things you can do at home in regarding to lifestyle to manage MGD. But thankfully in the clinic, we do have different procedures that help treat and manage MGD as well. Some of these treatments we have already featured in other dedicated videos, and again, I'll put those in the description below. But most of those do involve some form of thermal compression, which involves adding heat to the eyelids to melt those thickened oils trapped in the oil glands, and then some sort of compression technique to squeeze out the thickened and inflamed oils. And the whole point again is to get all of those thickened oils out of those glands so that you can produce healthier oils, which will coat the tear film and prevent your tears from just evaporating into the air. And studies do show that about 80% of everybody with dry eye symptoms has some form of MGD. Two forms of thermal compression that I've personally had is LipiFlow, which we've done a video about, and then iLux, which I've also done a video about. There are two other ones that are available, and those are called TearCare and MibaFlow. But essentially, they're all kind of around the same thing. Again, you're compressing and adding heat to those eyelids and getting that gunk kind of expressed from those eyelids. Now, people often ask, for those procedures, how much do they cost and how often do they need to have it done? As often as you need to have it done really depends on how severe someone's MGD is and how aggressive they are with their own at-home lifestyle and treatment at home, like doing warm compresses, for example. Most of the patients I've seen usually choose to get it at least once a year, maybe up to 3 or 4 times a year for people who are really severe, or at least initially to get things under control. As far as price for these different treatments, it is going to be largely depend on the clinic that you go to, what they're able to offer it to you for, but I usually see it anywhere from like $600 US up to like $1,500 US. And unfortunately, insurance does not cover these procedures at this time. But thankfully, for a lot of clinics and people, if you have some sort of health savings account, you can always use it toward that. I do also want to mention that these procedures don't hurt at all when they're done. In fact, they feel very comfortable when you're getting it, especially the heat. It's kind of like a spa treatment in a way, but it does feel very good on the eyelids, and I notice improvement myself, and many of the patients I have, they notice good improvement afterward as well. The important thing I also like to mention about the thermal compression techniques, such as using LipiFlow, these techniques often are used not necessarily to improve your symptoms. We hope as an eye care professional we can get your symptoms to improve with dry eye, but it's often even used as kind of a rescue technique because some people's glands have atrophied so far, we'll use it just to help keep the few glands you have left alive, because we don't want those to completely die off and then there's no hope of getting the glands back. So if you have had either LipiFlow or some other thermal pulsation technique already and didn't have success, make sure that you talk with your doctor that what they are expecting out of that procedure to get for you, as well as if maybe more than one treatment may be needed in your case if you have a really severe form of MGD. But I have personally had success with it, and I know some patients of mine have even come back a year or 2 years later specifically stating, I think I need that again because my symptoms have come back. But thankfully in our clinic, and hopefully clinics that you may go to, they usually do have some form of meibography technique to measure not only what glands are still available and healthy for that treatment, but also so that they can measure how much oil is secreting and resting on the tear film. because that's a good way for us to measure if something is improving after that treatment. Now, moving on to another treatment which I find a lot of success with our patients at our clinic is that of using amniotic membranes. An amniotic membrane, if you've never heard of that, the amniotic sac is a sac that covers around a developing fetus and helps provide it with healing tissue as well as preventing scarring formation. And so this sac can be harvested and is used for many different medical and surgical treatments. And so for patients who have chronic and severe ocular surface damage from dry eye, this is often just a huge lifesaver. In many ways, it's kind of a reset button because these patients have tried many other treatments, conservative treatments or medications, and they just haven't worked. And so by hitting the reset button, helping the eye heal, then hopefully a lot of those other treatments and medications can kind of take hold and start having a better therapeutic benefit. Amniotic membranes for the ocular surface are typically used either in a cryopreserved form that's frozen and then has this large plastic ring on it, or it can be used through a dehydrated method, which a dehydrated membrane is placed on the eye and then you have a bandaged lens put over that to hold it in place. And these are typically kept on the eye for at least, I try to go 4 days, if I can, a full week, depending how a patient responds to it and just their overall comfort with the fit. But while it sits on the eye, the amniotic membrane does dissolve and releases a lot of these healing properties to help kind of restore the ocular surface. And amniotic membranes are used for many advanced ocular surface diseases, such as ulcers on the surface of the eye and toxic burns to the surface as well. But again, myself and many of my colleagues have had just outstanding success with use of amniotic membranes. The only downside to use of an amniotic membrane as a patient is it is rather uncomfortable and you can feel that something is on your eye for several days. Now, the other thing is that oftentimes patients who have severe dry eyes, they're so used to this pain, irritation all day anyway, so it sometimes doesn't even faze some people. But it is quite remarkable the patients who will have it done on one eye and then several weeks later they'll get the other eye done, and they can just tell for those few weeks in between how different the one eye feels versus the eye that has not been treated yet. As far as pricing and insurance coverage for amniotics, many health insurances do cover the use of amniotic membranes. However, they do usually need proof that you've tried several other more conservative treatment options, whether they be at-home conservative treatments using eye drops, warm compresses, or also using medications such as steroids or other of the options that we've talked about. As far as access goes for getting an amniotic membrane placement, unfortunately, only about 10% of eye clinics are using amniotics at this time. It's not that eye doctors don't necessarily know how to use them, but they sometimes are difficult to carry and sometimes even difficult to get reimbursed for. So it's something that a lot of clinics I know are starting to incorporate as more people learn about it. But certainly is a more advanced option, and I think a fantastic option for a lot of people with severe dry eye syndrome. Another option that's similar to the use of amniotic membranes, except is in the form of an eye drop, comes from a company called Regenereyes. This is a biologic eye drop that houses a lot of healing properties, which are chemokines, cytokines, and other growth factors, which are, again, incorporated into an eye drop that you can use that can help with healing of the ocular surface, especially with chronic and severe exposure and dryness. The only downside of these eye drops is that they do often carry a higher price point, where as a patient you are going to need to get a prescription for it, and then you're going to be paying several $100s a month to keep that going. I personally have only prescribed it for about 3 or 4 patients and never used it myself, but at least 3 of the 4 patients I prescribed it for have had good success with it. In fact, I have one patient who I know does fantastic with it, and that's basically what's brought her the most success over all the other treatments that we've tried. But again, just another option out there, and I want you to know about it. Now let's move on to scleral contact lenses. Now, scleral contact lenses are large fitting contact lenses which in fact vault over the cornea, the front surface of the eye, and they rest on the white part of the eye called the sclera. And I know a lot of people who have dry eye, you're thinking, wow, I couldn't wear contacts anymore because my eyes were dry. How are these contacts going to work? Well, because these are more rigid contact lenses and they don't touch the surface of the eye, they vault over the surface, they hold fluid behind the lens. It's kind of like having a bowl of fluid that is constantly defending the surface of your eye, and it's trapping and holding liquid to the ocular surface. So if you have chronic exposure and dryness, you basically are getting this shield of defense and liquid constantly bathing the surface and helping it heal. And this is in fact a spot of debate in the eye care world of really medical treatment for dry eye versus scleral treatment for dry eye. But the reality is the mix of both are great options for people. But as far as scleral lenses, the only real downside to having these fit for a treatment of dry eye is, again, they're usually not covered by insurance and they do have a heavier price point. Fitting of scleral lenses does take a lot more time, as well as a heavier clinical component by the provider. They do have to have experience and training in the fitting of scleral lenses because they do have to be custom made for each of your eyes, because your eyes do not have the same prescription, they're not the same shape, and they may not fit the same way. So for the clinical fitting and for the lenses themselves, don't be surprised if the price point is upwards of $2,000 or more. However, they can be made in your prescription and oftentimes can give you some of the best visual quality that you can have, even more so than glasses or LASIK some of the time, depending of course on your eye health and your prescription and the fit of those lenses. But for example, at our clinic, not only do I fit scleral lenses myself, but my colleague, Dr. Faso, he is a complete magician when it comes to fitting scleral lenses. And so when we have a patient that is just not responding to typical medical treatment for dry eye, we often work with them to get a specialty lens designed for them. One other challenge that does come with fitting of scleral lenses is also the ability to put those lenses in. More so than just soft lenses, which I have videos going tutorial about, large scleral lenses are more difficult to get into the eye. And so there is a whole other technique to getting them in and taking them out. Thankfully, I have done a video on that insertion and removal process. And again, if you want to learn more about scleral lenses, again, I'll put links to all of that, again, below the like button in the description. But hey, I know we've covered a lot in this video. This video is certainly longer than most other videos I have here on YouTube. But if you have questions, please let me know in the comments about any of these dry eye treatments, any other medications, or questions that you may have. I'd love to hear those comments, and I'd love to get back to you guys. And based on your comments, I do direct what type of content I'm going to be making in the future. So again, please, if you're watching this far in the video, leave us a comment. I love hearing from you. Either way, I appreciate you watching this far in the video. If you want to learn more about dry eyes or any other topics in the world of eye care, please check out other videos in our video series that are just coming up. Otherwise, keep an eye on it, and we'll talk to you soon.